Hey, what's up, guys? It's Confessions of a Doctorholic with Hafsa Slavin, and I've got the Queen of Eyeliner back on air. All of yous have asked for her back after you've heard about the cardiac arrest case. So, we've got her on again. Nora, how are you?
Ready.
Last year, while we were all on rotation, we had assessments and we had to see patients and then we had to comment on them, and sometimes we'd be put on the spot by doctors and they'd ask us things about medication, sometimes about the patient.
Oh my God.
And I know you've had a wild story. So tell me what happened to you.
So, while on placement, I was put with one of the smartest, most intelligent doctors.
I know who you're talking about.
Okay, you know.
Yeah.
And he's quite intimidating. I mean, it's just he knows everything. And he studied in the UK.
Fun fact, right? So, like, we've all been speculating his age. We know, like, random things about him. Like, he likes wearing bow ties. He drinks Coke all the time. Apparently, he graduated in, like, 1978 or something, which means he's, like, in his 70s at least. I mean, he looks great for 70. Like, I don't know what he does, but I need some tips from this guy. Yeah. Anyway, you were saying.
So yes, we joke. He's like the god of the gods of medicine. He's one of the gods of medicine.
Okay.
He's like the Zeus of medicine.
Okay.
And so I was lucky enough to be put with him. But I'm the kind of person that, you know, if you ask me a question right on the spot and it's a stressful situation, I blank. I just blank. Yeah. And it's something that I'm trying to work on. So I remember we had a patient in his clinic and the patient left. And, you know, after every patient leaves, he'll ask us a question about the medication, the history. And I remember this was like the first week with him and I was already super intimidated to be with him. And he asked me, what are the side effects of metformin? And metformin is, a drug for diabetes.
So you had a diabetic patient. Was that what happened?
Yes.
Okay, yeah.
Yes.
Yeah.
And so quickly he was like, side effects of I was just like, it's a teratogen. And he was like, it's a what? And I was like, oh my God, I can't believe I just said that, because methotrexate is used in like cancer therapy or like as an immunosuppressant. And basically, if you take it while you're pregnant or planning to get pregnant, it could cause, deformities in the child. And metformin is such a basic daily drug that diabetics use. It's certainly not a teratogen. And I think I just sounded so clueless to him. And I was like, great, this is such a good first impression. The first week, first I had a cardiac arrest. Now I'm here. I'm about to have a cardiac arrest myself after I said that. He was just like, couldn't believe what I just said. So that was one incident. And the other one was all the students, you have to do kind of like a mini assessment on a patient. So the doctor might tell you, okay, this is a patient that we have. Why don't you listen to his heart and tell me what you hear,
Yeah.
So this doctor decided he's going to take me to the ICU where there are like critically ill patients, not in good shape at all. Here I am thinking that he's just bringing me up there to, show me the status of the patients, to go over their medication. And all of a sudden, he's like, right, okay, like go do the respiratory exam on this gentleman right here. And I mean, the gentleman was an elderly man who was so frail and he couldn't even sit up. Like, he couldn't sit up. And I was looking at the doctor like, sir, like, I can't lift him up. And so he was like, no, don't worry, not at all. And so he just plopped this man up. And he told him, I'm going to lift you up so that this medical student can listen to your
But
lungs.
You weren't expecting that.
But I wasn't expecting that. So I'm in shock because, I've never really dealt with critically ill patients before. And I mean, in the end, it was a good learning experience. And we're all going to have to deal with these kind of patients.
Yeah.
But, so yeah, he's like, go on. And I'm like, oh my God. So I take my stethoscope and I listen, to his back for the lungs. And I do my respiratory exam. To the best of my ability, I rushed, obviously, because the gentleman was quite frail. Then he laid him back down. There was not a problem. And then the doctor asked me, like, so, like, what did you hear? And, I told him that I heard, I think, fine crackles. And he was like, right, so what is that like indicative of? And oh my God, again, I did such a stupid mistake. I wanted to say like pulmonary fibrosis, right? But
Okay.
I was so in shock that he was like interrogating me right on the spot. So I said cirrhosis. And he was like, what? Oh my God. And it took me a while to remember that cirrhosis is for the liver.
Yeah. Oh my God.
And he was just like, this girl. But in the end, I explained to him afterwards. I was like, I'm so sorry, doctor. Like, I know all of this stuff, but like when I'm put on the spot, I'm not used to being put on the spot.
And especially by him.
Especially by him, the gods of all gods of medicine. And he was like, no, it's fine. Like, it's just something, that you get used to with time as a medical student. So
that's quite nice.
Yeah.
His
So in
response
the end, he was reassuring. But just tough being a medical student and being asked questions by doctors. They expect you to know not the generic names of medication, but like the actual medical terms for them. And you just have to be ready with this kind of stuff. Like, if you want to be a doctor, you have to talk like a doctor as well.
Yeah, definitely need to work on that. Speaking of this lecturer, by the way, it was my final week of medical placement. Mm-hmm. And you know how final week they help you practice your clinical skills, and you also practice history taking skills. So you ask patients questions that help you identify what the problem is, right?
Right. Mm-hmm.
So we had him, and he was like, so what do all of you want to do? All of us were like, oh, okay, we want to practice these skills. And he was like, alrighty, we're going to do like a clinical history. And he was like, any volunteers? And no one raised their hand. And I was like, okay, fine, I'll take one for the team. Like, let's just get this over and done with. So I raised my hand, and he's like, right, you're doing the clinical history on me. And I kid you not, I had a heart attack in that moment, because I'm just like, no, I'm supposed to practice this on like someone else. Like,
yeah,
not you. Not you. Definitely not you. Anyway, so I'm there pissing myself, and like literally I'm shaking and I'm sweating, and I sweat so much as well when I'm stressed. So like, I'm sweating, and he's like, all right, I'm going to give you a moment. And then I'm sitting in front of him, and he's just like, I'm asking him a question, and he's like hammering me with like the answer. And when you're practicing history on like people who know what they're supposed to do, he's giving me everything. Right. He's giving me complicated terms, and I'm just like, what do you want from me? Give me a break. And then in the end, he's like, what are your differentials? And I'm just like, oh great, he didn't even give me a moment to think about it. And then I'm like, prostatic hyperplasia.
yeah
And he's looking at me like I'm retarded. I'm not even joking. He's like looking at me like, how are you in medical school right now? No, and then he was like, that's like the third thing on the list. The first
okay, at least it was one.
I know, but you know how he's like, he scares me.
Oh my gosh, that
scares the life out of me.
He brought me up to see a patient, and the patient had cystitis. So my placement with him, by the way, was the first week of school. So it was before all of these lectures on, specific conditions. It was before me starting to study for the USMLE. So he took us up to see a patient, and the patient, it was a female. She had fever. She had chills. Classic, like a urinary tract infection. So he brought us up to the patient, and then in the end, he was like, okay, what does this patient have? And I said, urinary tract infection. And he was like, oh, to call it a urinary tract infection is like to say World War II was a mere disagreement. I was like, what? And in the end, I like, okay, like now I know like there's specific terms, like for her, she had cystitis, nephritis, something like that. And so now I definitely keep that in mind, and I never use the word UTI. It's not in my vocabulary anymore. I have to be specific about like where exactly in the urinary tract it's happening. So don't call it a UTI if you have him.
Fair enough. All right, guys, we hope you enjoy this episode. This is what happens when you get a very scary and a very good teacher in medical school. So let us know, what have your experiences been? Have you had any lecturers that were kind of intimidating because they're just that good? Let us know. All right. Thanks once again, Nora. That was great.
Yeah, my pleasure.
Okay. See ya.
Bye.